In today's topic, we are going to study what is the scapulo-humeral rhythm. We are going to understand the diagrammatic representation for scapulo-humeral rhythm, study the ratio and how to remember the scapulo-humeral rhythm. We will also learn what is the scapular plane and finally learn the lumbo-pelvic rhythm. Scapulo-humeral rhythm. The scapula on the thorax contributes to elevation, that is flexion and abduction of the humerus, by upwardly rotating the glenoid fossa 50 to 60 degrees from its resting position. The glenohumeral joint, which is also the GH joint, contributes to 100 to 120 degrees of flexion and 90 to 120 degrees of abduction. If the humerus were immobile at the glenohumeral joint, the scapula alone would result in 60 degrees of elevation of the humerus relative to the thorax. The humerus, of course, is not immobile but can move independently on the glenoid fossa. This combination of the scapula and the humeral movement results in a maximum range of elevation of 150 to 180 degrees. Now let's understand this diagram. So this is the scapula, this is the humerus. 120 degrees of motion is done by the glenohumeral joint and 60 degrees is done by the scapulothoracic joint. When the total range of elevation is considered to be 180 degree, it is common to attribute 120 degree of range of motion to the humerus at the glenohumeral joint and 60 degree to the scapula on the thorax, with the two segments moving concomitantly rather than sequentially. Sometimes variability in the ranges is due to structural variations or trunk contributions. If trunk motions are not included in the measurements, the overall range for most people is closer to 150 than 180 degree. An overall ratio of 2 degrees of glenohumeral to 1 degree of scapulothoracic motion during arm elevation occurs, and this combination of concomitant glenohumeral and scapulothoracic motion is most commonly referred to as the scapulo-humeral rhythm. Now let's understand this ratio of 2 is to 1. It means that glenohumeral is to scapulothoracic motion is 2 is to 1. So in order to complete 180 degrees of motion at the shoulder joint, 120 degree occurs at the glenohumeral joint and 60 degree occurs at the scapulothoracic joint. A point to remember: whenever you want to remember the ratio of glenohumeral to scapulothoracic, that is, it is 2 is to 1, please note that since scapulo starts and humeral ends, it is not 2 is to 1 for scapulo to humeral, but rather scapulo is 1 and humeral is 2. So scapulo is 1 and humeral is 2. So glenohumeral to scapulothoracic is 2 is to 1. According to the 2 is to 1 ratio framework, if flexion or abduction of 90 degree in relation to the thorax will be accomplished through 60 degrees of glenohumeral and 30 degrees of scapulothoracic motion. That means for 90 degree of motion to be achieved, according to 2 is to 1, 60 degrees occurs at the GH joint and 30 degrees occurs at the scapulothoracic or the ST joint. However, Elevation of the arm is accompanied not only by the elevation of the arm or the humerus, but also by lateral rotation of the humerus in relation to the scapula. During flexion, an average of 51 degree of lateral rotation has been reported. In addition, the plane of elevation varies for the humerus relative to the scapula depending on the plane of elevation to the thorax. First, let's understand what is the scapular plane. Remember that the scapular plane is medially rotated approximately 30 to 40 degrees from the frontal plane. So, if this is the frontal plane and if this is the sagittal plane, remember that the scapular plane lies 30 to 40 degrees anterior to the frontal plane. When asked to actively elevate in a scapular plane, subjects on average positioned the humerus 5 degree anterior to the scapular plane. During flexion, the glenohumeral plane of elevation is increased up to 30 degrees anterior to the scapular plane, and in abduction, the glenohumeral plane of elevation was up to 20 degrees posterior to the scapular plane. As long as the trunk does not participate in the motion, the degree of elevation of the arm from vertical and elevation of the arm relative to the trunk will be the same. This is because the trunk may laterally flex or extend to gain additional range of the arm. Now let's study what is the lumbo-pelvic rhythm or the lumbar pelvic rhythm. The activity of lumbar flexion, anterior tilting of the pelvis, posterior pelvic shift of the pelvis in the sagittal plane during trunk flexion and extension is coordinated. Remember that in most of the textbooks, posterior pelvic shift of the pelvis is not mentioned. This combined lumbar and pelvic motion is called the lumbar pelvic rhythm. The activity of bending over to touch one's toes with the knees straight depends on the lumbar pelvic rhythm. So we were referring to this diagram, that is touching one's toes or the ground without the knees bent. Return to the erect posture is initiated by posterior tilting of the pelvis at the hips, followed by extension of the lumbar spine. The initial pelvic motion delays lumbar extension until the trunk is raised far enough to shorten the movement arm of the external load, thus reducing the load on the erector spinae.